Good afternoon, everyone. I think we'll start now. Hope you can all see my screen. Yes.
Yes, Karen.
Yes. Good afternoon. My name is Karen, and I'm an urban designer for Healthy Cities. Currently, I'm doing an internship in the UN Habitat, and I would like to extend all a welcome for today. Thank you for making the time to join us. This is our second learning session during the Urban October, as you know, and we're really grateful to see you all today. Sorry. Okay, so I'll start by just talking about the agenda, what is going to happen in our session. So today we have like a 1-hour session. We will start by an opening remark, and then every speaker, we have 3 speakers. All our speakers will have 8-minute intervention each, and then we will finish by a Q&A section that will follow like a 5 closing remark. And I hope you really enjoy the session. We would like to remind you the house rule keeping. This session will be recorded. Please mute your microphone if you're not talking. Yes, and then we'll try to share this recording with you in the course of the week. And write down your question, because at the end of the session, as we said, we'll have like a QA session. You can ask your question in the chat. Yes, and finally, please reflect and share all the questions there. Thank you. So before I give the floor to our moderator, Lydia, we would like to do a small poll to understand where you're joining us from, your background, your knowledge about urban health and AI, their intersection in general. You will see right now a prompt. Let me know if you're all receiving the prompt. Yes. As you see a prompt, you can start by telling us where you are joining us from, which country. Yes. And then if you click on the next button, you'll see where we are asking about your background. If you're from the urban health professional, it can be also from the academia, an urban planner, you can be a policy and decision maker. We are really happy to have people from different backgrounds, and we'll have to know like where you're from. And finally, we'll rate just your understanding in general about AI. Yes, and we hope that this session will help you increase your knowledge about AI for urban health, for sure. Yes. You can go on and start. Yes. Oh, thank you so much. We can start seeing some answers. Yes, a lot of people are joining from Germany, Spain. Oh, wow. Europe is winning. Yes. We have people from Belgium too, Nairobi. Thank you so much for joining from Zambia to India, China, Senegal. We have so many countries. Yes. We also have so many backgrounds. Yeah. Exceptionally, urban planners are really winning. Also experts in AI. Yes. Okay. And we can see that we have like a good level of understanding about AI for urban health. Yeah, which is good. Yeah. With that, I will give the floor to Livia, who will be moderating our session today. Yes, Livia is a technology innovation specialist in UNITAC, in the UN Innovation Technology Accelerator for Cities, and also support the People-Centered Smart City Flagship Program at the UN Habitat. She has a background in international relations, human geography, and technology. Yes. Livia, the floor is yours.
Thank you so much, Karin and Christelle, for organizing the sessions.
Thank you everyone for joining us today. The session today is co-organized by the Urban Health Workstream and the Innovation Unit team who leads the flagship program on people-centered smart cities at UN Habitat. So first, maybe I tell you just a few words about our flagship program on people-centered smart cities that really focus on how technology, data, and innovation can support cities to be more sustainable, more inclusive, ensure prosperity, and guarantee and promote human rights. So this is our people-centered approach. And the idea with that is that we move from being supply-driven in the way that we connect and use technology to being more needs driven, to understand how technology can actually solve real problems in cities. And then also make sure that the deployment and use of digital solutions and data really contributes to a better quality of life for people living in cities today. This is particularly important then when we talk about AI to really provide these contributions to make cities healthier. And more we see that the concept of healthier cities is increasingly interlinked with people-centered smart cities, representing this approach to urban development that prioritizes technological innovation as a driver and enable of well-being of residents. So we know that this rapid urbanization and environmental and climate changes, they have this, and they pose significant health implications for people. And that poorly planned and rapidly urbanized cities can increase the exposure to health hazards. In this case, we're talking about heat waves, air pollution, contamination, respiratory diseases, including a range of burden of both infections and non-communicable diseases, for example. So we acknowledge that emerging technologies, including AI, can transform how cities are understood and managed at different levels, managed and planned. In that we know that AI, we acknowledge that AI can be a driver to support cities in making more informed urban decisions by leveraging advanced technologies and data analytics to optimize this infrastructure, to improve efficiency and enhance the deliverable of urban service. So there are also examples of how technologies can contribute to healthier living environments by addressing issues like traffic congestion, pollution, urban heat islands, water quality, and provision of water and sanitation service, for example. We also know there are versatile applications for sustainable urban development, which we hope to shed light on some of them in today's sessions. So I'd like to then pass the floor to the speakers today who will contribute to these discussions and bring more knowledge on this topic for everyone here. The first speaker I would like to introduce and welcome to the floor is Sarah Skenazy, who is an urban planner and public health practitioner, focusing on the elimination of health inequalities. And having Sarah joining us today from this lens of public health practitioner is really key when we talk about urban health. Sarah is currently a guest editor at the Oxford Open Journal on Infrastructure in Health, which I believe she will talk a little bit more later as well. And she has previously been a clinical specialist on the health AI team at Google too. So Sarah, we would like to hear from you today, and the floor is yours. What is the role of urban planners and the health sector in fostering equitable urban AI? What is the advice that you have for the audience today as they navigate this AI landscape in terms of balancing policy development and innovation? So over to you and welcome.
Thank you so much, Livia. I'm going to come back to that question to open up the Q&A part, if that's okay. Would you all like me to pull up the slides? Yeah, okay. All right. I'm joining you from the pre-dawn hours of Oakland, California on unceded Ohlone land. I've spent the past 15 years working to integrate a health equity and a social determinants of health lens into large-scale infrastructure projects. So from regional transportation networks, district master plans, to technology products built to surface authoritative health information about vaccine access or health risks of floods and wildfires in climate vulnerable communities. I really love that the organizing frame for our coming together today is a learning session. And I'd like to share with you what I've been learning about integrating machine learning and AI, really a methodology to provide insights into automation of urban health infrastructure, and then to propose some questions for us to wrestle with about the impact of automation on urban health equity. And I hope your takeaway from today is that urban planners and health practitioners play a really unique and vital role in the creation of healthy and equitable cities that use some form of computational statistics to deliver services to their citizens. And in this rapidly evolving technology landscape, our era of climate collapse, you all will be really instrumental in ensuring that our cities become more instead of less equitable. So, setting the scene a little bit for our discussion. Urban planning was, I went too fast. We'll get here. Setting the scene a little bit for our discussion. Urban planning was born out of a need to address public health in our cities, a need for separated land uses, sanitation, limited toxic exposures. Today, around 55% of the world's population live in urban areas, and by 2050, that number is expected to rise to 68%. So urban health really matters in critical ways for more and more people. And the way cities are planned and managed shapes the environment in which health happens, driving significant changes in the global burden of disease. So as urbanization and climate change intensify, existing population health issues will introduce new challenges, and the effects will not be distributed equally. So cities concentrate risks and hazards for health, especially for racialized and minoritized residents, and rapid urbanization will compound and conflate problems like extreme poverty, pollution exposure, and food and housing insecurity for already vulnerable citizens. So our discussion today centers on the role of artificial intelligence in cities. But first, I want to unpack what we mean by this often ambiguous term. This term has a certain specific historical context in the field of computer science starting in the 1950s. It's now used colloquially to describe both a field of scientific inquiry and a range of applications. And unfortunately, also just as a marketing term, a strategy to make certain types of automation sound sophisticated, powerful, or magical in a way that can actually distract from the distinct benefits and risks that exist in the technology tools today. Because the term AI is ambiguous, it can make having clear discussions more difficult. The OECD defines an artificial intelligence system as a machine-based system that can, for a given set of human-defined objectives, make predictions, recommendations, or decisions, influencing real or virtual environments. So the objective for an artificial intelligence system is the translation of a human-defined goal into a mathematical one. My favorite current thinker on the words that we use to talk about technology is the linguist Emily Bender at the University of Washington. And I'm leaning heavily today on her excellent suggestion to, wherever possible, replace the phrase artificial intelligence with more precise descriptors around automation. So if we use the word automation, we can then ask, what is being automated? Who is automating it and why? Who benefits from that automation? Who is or could be disproportionately harmed or made vulnerable as a result of that automation? Is domain expertise guiding a clear pathway to impact? Is it measurable? Is it built on relevant peer-reviewed research? And very importantly, who has accountability for the functioning of the automated system? So I'm going to show you what I mean by looking at some examples together. But while I'm talking, I want you to think about these questions around automation, accountability, and impact. So because climate justice is my personal North Star, some of my favorite examples in practice today include real-time environmental, geospatial, and urban infrastructure analysis, powering on-the-ground hazard prevention and extreme weather management and recovery efforts. So for example, floods are the most common natural disaster, causing thousands of fatalities and disrupting the lives of millions every year. Machine learning can help generate insights by combining geospatial, hydrological, and built infrastructure building footprint data sets to help emergency response agencies understand which communities are at highest risk of catastrophic flooding, including sending early warnings and prioritizing areas for upgrades and investments. Similarly, you can use machine learning to comb through vast amounts of satellite data to track real-time wildfire boundaries, to aid in firefighting and resource allocation. And you can also do things like simulate traffic patterns to model city evacuation routes, study egress, and find viable modifications to make those plans more effective and more life-saving. So keeping those guiding questions in mind, what might be important considerations when implementing any of these tools in an urban context through a health equity lens? So to begin, notice that the data being analyzed in each of these examples is about environmental conditions, not people. So we need to ask, is there disparate risk to vulnerable populations in any of these settings? How do these impact the people that it's telling us about living in these spaces? Last year, the UN released a report stating half the world lacks adequate early warning systems for disasters like floods and fires. So how might these tools help us plan more comprehensively? What about bridging last mile access gaps for communities without reliable early warning infrastructure or even broadband? Are we considering what sort of emergency services baseline might exist in more heavily resourced communities versus those that are structurally underserved? And a hypothetical, if I was the 100th city manager to implement one of these tools after hearing about its success in other cities, and the fabric of my city was dotted with informal settlements whose boundaries were rapidly evolving and not easily picked up with satellite imagery, how would I know if pre-training data accounts for them? Could the institutional knowledge of the exclusion of my most vulnerable city residents get overlooked and thereby exacerbate their vulnerability, potentially for generations? What I wish so many urban health solutions had is a deep commitment to local ownership of local data and co-design for locally targeted tools, a clear path to measure the health impacts and both document and mitigate the risks of a given intervention, and sufficient transparency in the algorithmic development process itself for subject matter experts across fields to really dig in on the assumptions and independently validate the data. In presenting examples of applications I'm excited about, I would be remiss to not talk about the very real harms to health equity posed by automated computing applications today. So there is enormous potential, especially for automated assessment systems, to cause harm to people and their health, and to cause more harm to people who are already at a higher risk for a whole range of chronic and acute health risks due to being relatively disenfranchised in our cities and societies. So examples of applications with harmful implications for health equity include discrimination in housing, criminal justice, and healthcare, immigration and migration management, welfare provision, policing, and warfare, in addition to the labor exploitation and mental health impacts involved in building automated technology tools in the first place. So one thing that many of these use cases have in common is that they're purporting to increase efficiency and cost savings for processes and programs that are already rife with a history of structural bias and exclusion. In AI, we say garbage in, garbage out. If bias goes into the training data, bias will come out. It's a reflection of our society. So adding a technological layer on top of administrative systems can increase opacity and take agency away from the people that depend on these systems for things like childcare subsidies, housing access, or food stamps, vital elements of urban infrastructure for health. So I'm going to end with a wish and a warning. My wish is that when we look back on this period of rapid technological advancement and this generation of automated computation models, we see the development of a strong evidence base that stands up to peer review and rigorous critique, and that these tools are put to use to address not only downstream symptoms of inequality, but the root causes that lead to disparities in health outcomes across the globe. So as the Ethiopian cognitive scientist Abiba Burhani wrote in her essay Fair Warning a couple of years ago, adopting an AI or a machine learning solution rather than a more comprehensive approach to social issues remains widespread. It can be seen in technology for social good initiatives, which reduce intricate geosociopolitical and cultural challenges to formal code and prioritize technological solutions. So as urban planners, we know that the term solution is vastly overused when talking about the complex societal issues playing out in our cities in ways that impact our urban citizens. And yet, these are powerful tools to have in our toolbox. So in closing, I really encourage all of you to push back on the AI hype and to get really specific in the ways that you scrutinize all automated computation tools. And I'll close with some wisdom from computer scientist David Rolnick from the fantastic organization Climate Change AI. AI is a tool. It is not a silver bullet, and it is only relevant sometimes. The highest impact applications are really not always flashy or sophisticated. And as subject matter experts, it's really up to you all to ensure you're scoping the right problems, shaping pathways to impact, empowering diverse stakeholders, and prioritizing the right use cases. So in closing, I did just want to mention, as noted before, that I'm currently serving as a guest editor for a special collection on AI infrastructure and health for Oxford University Press. And if anyone's interested in getting involved, potentially submitting to that, please reach out to me.
Thank you so much, Sarah, for that. I think that has been a really good introduction to what we were saying, what a people-centered approach is, to understand the real value of the AI systems and applications to a defined and clear problem that we face in cities. I think your point about AI also being used as a marketing to promote some technologies is really important questions to see exactly what is the problem that's being addressed and scoped for that, and taking an open data and open knowledge approach to be transparent. Also, what is that has been automated? What is the data behind it? What is the decision-making process that the tool is taking? So thank you for those. With that in mind, then I would like to introduce our second speaker today, Dr. Catarina Fontes, who is a postdoctoral researcher at the Technology University of Munich Institute of Ethics in AI. Catarina currently works on a project for the ethics of the smart cities, looking at the risks and benefits and governance in the ethical implementation of AI within the smart city agenda. And Catarina, would like to then hear from you, how can AI enable systems to improve urban planning and create healthier environments? If you can share, for example, an example with us, and also from that, how this input can improve policies. So over to you, the floor is yours.
Hi, Livia. Hi, everyone. Thank you for the kind introduction and also for the invitation. It's my pleasure to be here. I will go back to your question, but maybe first let me try to share my slides. I hope it works, and please confirm if you can see them. Does it work?
Yes, we can see it.
Perfect. Thank you very much. So that's a quite broad question, and I will today present you a little bit of a new concept that it turns out it's not that new, as it resonates with the idea of a digital footprint that we are all leaving behind when we are online. But this has multiple applications and also potentials in several spheres and several use cases that I will try now to connect with urban health. And I find that this is interestingly a complementary approach to Sarah's, as she came from infrastructure to discuss issues of AI at a societal level, and I guess I will come from the level of the individual and also go to discuss the impacts of such tools at the societal level. So I find this an interesting complementarity, maybe. Yeah, so I would start by saying or questioning what do we think of when we think about health and healthier cities. So I guess one approach that comes to mind leads us to think about how we can bring human habitats closer to nature. Yet a second one, and the one we are more framing today, and I would even dare saying often conflicting with the first one, tends to push the limits of technology to further embed artifacts, so artificial features, in such human-made environments. And cities have always been particularly exposed to this tension between natural and artificial worlds, as they are sort of a manifestation of how the evolution of society has been embracing technological advancements to unlock new chapters. So we see, for example, here how in academia there have been many approaches trying to combine the advancements of the industry and also healthcare and other sectors, and locking them in this pathway towards societal evolution. So we are moving on to Society 5.0, as they say it, and in Society 5.0, they are envisioning a super smart society having as core values sustainability, resilience, and human centricity. And we are also moving from highly networked cities that representing the information society towards autonomous decentralized systems that are merging physical and cyberspace. And here comes the human digital twin as a potential framework and also a bridge between physical and cyberspace at the individual level. So the concept of human digital twin has emerged as a framework designed to create digital replicas of and possibly for individuals aimed to deliver highly meaningful information, personalized recommendations, and to naturalize human-machine interactions. It entails synchronization to leverage data collected in real time and also self-learning models. At a stage of full completeness, the system should also be endowed with a high level of autonomy, which means, and this is already happening, context awareness, but also possibly consciousness to process in detail the preferences of users and also their own individual systems of values. And what does it mean in terms of unlocking Society 5.0 vision? Human digital twins will be associated with the idea of hyper-personalization, but also the possibility of unlocking other forms of collective intelligence. It will also enable human-machine interaction and novel ways for human-robot collaboration. But another aspect is that it will irrevocably transport humans to cyberspace by creating human cyber-physical systems and cyber-physical social systems, and more to come. But these are two frameworks that are currently very present in the literature. And when we try to transport it for healthcare 5.0, so the new vision for healthcare, it means that human digital twins will enable personalized treatments and medicine, also rapid and self-diagnosis, and the pre-testing and predicting responses to surgical interventions. They also will enable leveraging collective intelligence and empowering self-reflection and self-coaching, and enable the extension of human life through data-driven approaches. And now we go back to urban health and try to combine these perspectives at the intersection. We find that human digital twins can assist in, for example, the decentralization and democratization of health data by giving user control over personal data related to health, and namely the possibility of sharing it for different purposes with preferred stakeholders. They can also assist in surveillance by assisting public authorities while monitoring public health. For instance, we have all been exposed to contact tracing apps, or smart cameras can be used to detect potentially dangerous and contagious diseases in public spaces. As well, intelligent ambient can be used for public awareness on health and healthy habits. And this means that human digital twins can be linked to our intelligent ambient. It means sensors and also other interfaces such as dashboards to inform about environmental parameters that are relevant and tailored for the individual. And for example, offering tailored navigation recommendations in case someone uses a wheelchair or is at the moment pushing a stroller. They can also be used to empower self-reflection and self-coaching by providing recommendations to individuals based on the unique data and markers, and support and motivate behavioral change, which also can relate to positive mental health support. And finally, not finally, but they can also be then be used as channels for cooperation and communication by mediating the communication of specific groups of stakeholders that have less capacity to express their views in the public sphere, and by doing that, fostering a fair distribution of decisional power. And finally, they can be leveraged to harness collective intelligence and unlock collective value creation through the wisdom of crowds in order to build consensus on urban planning and urban management decisions that concern fracturing topics and wicked problems. Then I would also say that while it might be indisputable how human digital twin approaches can be helpful in aligning society with the values of sustainability, resilience, and human centricity, as we saw before, they are also subjecting individuals and societies to novel forms of surveillance, ubiquitous data collection, and also constant interaction with autonomous systems. This calls for a discussion about the novel and not so novel risks that these systems are bringing about, which relate to technical limitations of and malfunctioning, namely the biases and opacity that were already mentioned, but also privacy-related issues, security-related vulnerabilities, human autonomy and self-determination. He's also at the line in relation to control over the system and what is it used for. Also, it relates to data ownership and the system ownership, the production and operation costs that leave a footprint for environment, and what does it mean for sustainability, inequalities in access, and lack of regulation and accountability uncertainties. Also, we have to consider the potential misuse for deceptive, exploitative, and/or manipulative practices, and how this tech can also represent further means for mass surveillance, social control, leading to the erosion of democratic values and social cohesion. And finally, the wider adoption of human digital twins related concepts might mean also the disruption of established paradigms and values that should also be considered before we just move on to the uptake, to the full uptake. Namely, we have to talk about the value of privacy and what it will mean when this technology is pervasive. Also, how it will affect in terms of the relationship between humans, how it will represent the extension of human life through data and data-driven approaches. What will it represent for the disruption of the labor market and the economy, leading maybe towards a non-monetary economy, as some authors are pointing out. How we are moving from, in the industry aspect, from one size fits all to hyper-personalization, and what this will represent for societies in terms of the devaluation of human capacities. And also, for sure, we have to talk about transhumanism and technological post-humanized societies. And I will end for now, and thank you very much for your attention.
Thank you, Catarina, for that. I think it's very interesting, as you mentioned, that you brought this more individual perspective. And in terms of, I think, also human rights and the values of privacy and the protection of agency of people is interesting to see on your presentation how there will be this data ownership and also considerations over what existing regulations are there to protect those and make sure that the potential of these technologies to really provide personalized and customized service, increase the responses and mitigate these widespread diseases. So I think it's an interesting point that you made, especially also for us, or for me as well, from a digital rights perspective, to understand how agency privacy interconnects with these discussions of AI uses in urban health. So thank you very much for that. Then I would like to welcome our last speaker, Dr. Lameck Mbangula Amugongo. Lameck holds a PhD from the University of Manchester. His doctoral research is focused on image-based data and AI to personalize treatment for lung cancer patients as well. And he also has been working with the concept of ethics and the Ubuntu ethics. And he aims to leverage the responsible technology to really solve societal problems. So, Lameck, welcome to the session today. I think from you, we would like to hear how can AI be applied in low income or with regions with less resources. If you have also examples from other regions based on your experience and the localization of AI ethics and AI principles as well. So, welcome.
Thank you very much, Livia. Let me just try to share my screen. Okay, great. Can you see my screen?
Yes, we can.
Okay.
We can see your screen.
Yes.
Okay.
Mhm.
Okay. Awesome. Yeah. So basically, I'll just give a short presentation on how, for example, Ubuntu ethics can enable equitable urban health. So in healthcare, because of this routine clinical data and also user-generated data plus advanced computing, it makes artificial intelligence very attractive. And some of these AI innovations are particularly valuable in Africa and a lot of countries in the global majority because of the material conditions that are in those countries. For example, there's not enough clinicians, so we can actually use mobile diagnostic tools to support primary health care. We can also analyze public sector health data, including social media data, to actually track and how the virus is spreading across different communities. But importantly is that there are a lot of people that speak different languages. So getting access to information, for example, health information, may be difficult if you don't speak, for example, the main language in the country. So you definitely applications that are using technologies such as NLP may also be helpful in this. But we can also use AI to be able to reduce air pollution and improve environmental health. But the major challenge, for example, in Africa and most countries in the global south, is the lack of accurate, up-to-date, and complete representative data sets. So and if you want to do NLP project, there's no corpus in your local language. Sometimes there are lack of infrastructure or there's low digitalization of data. So one of the biggest challenge has always been access to data, and most people on the continent are actually working on curating contextualized data sets from the continent. And when it comes to health and projects from the global majority, there are actually several projects, and most of them are actually focused on trying to aid clinicians deliver optimal care. For example, in Kenya, there is a project being done by Jacaranda Health plus Google, where they are actually using a mobile ultrasound device that is driven by AI technology to be able to create a handheld ultrasound device that can enable people in different low-income settings be able to access to ultrasound scans so that it can improve maternal health for pregnant women. And in Uganda, for example, a startup called Sunbed AI is working together with the local city authority to help understand acoustic landscape of the city, whereby they set up sensors across the city to then look at the different air pollution and noise pollution in the different aspects of the city. And these technologies can be used to help people, for example, choose to live in neighborhoods that are that have better air pollution, or to help the city actually come up with interventions to increase air pollution, to create cities that have better environment. And for example, one of my students is, for example, working on a computer vision application that is on African food, because if you find most of the computer vision-based applications that are out there for food recognition are mostly not good on African food. They are usually good on European or Asian food because they were trained on those data sets. So for us to then be able to come up with an application like this, which can really help people with chronic conditions such as diabetes, really just manage the eat healthy at home without them having to know to have specialized expertise on, for example, carbohydrates counting. So we had to create kind of a new data set that was not there before. So, and this really most of the challenge that is out there, that if you want to do a project on the continent, you most likely have to come up with to create a new data set. And as we integrate AI into healthcare applications, it is really imperative that AI aligns with the needs, values, but most importantly, enable equitable care when it comes to health. Of course, the area of healthcare is not new to ethics. It has always been governed by ethics. And these, when it comes to AI ethics, the AI for People recommendations are kind of like the baseline, or they are the reference point for AI ethics in the global south, in the global north, and this has been mostly adapted from bioethical principles. But the biggest challenge with most ethical principles is that they prioritize rationality, they're individualistic, they focus on the individual rights as opposed to the well-being of everyone. They lack cultural diversity and historic diversity, so which makes them very not easily adaptable to different contexts. So we have to really rethink about how do we rethink AI ethics, and the relational perspective can really help ground this, help ground AI system for urban health to account for the lived experience of the different communities and really centering this on the marginalized. And what is Ubuntu? Ubuntu is a relational ethic or theory or philosophy that promotes Abantu or Umuntu. And it actually captures personhood as intrinsically linked to other people. And the Nguni proverb of Umuntu Ngumuntu Ngabantu, which just translated, a person is a person because of other people. What makes Ubuntu different from Western ethics? While Western philosophies begins with the individual, I think, therefore I am, Ubuntu begins with a group. I am because we are, and it opposes the capitalist ethos of how AI systems are being developed currently, and it allows us to shift a little bit from rationality to relationality on how do we relate with the world or the community that we lived in. And in our view, Ubuntu is the one philosophy that best aligns with the UN Declaration of Human Rights. And as a perspective, Ubuntu is not only worth considering, but it will ensure that as we develop AI systems for urban health, they are beneficial to all members of society. And just to conclude, the future of smart city is not just about the technology, but it is how we can actually leverage on this technology to enhance the quality of all citizens who live in the city. And there are certain examples that we can do now. For example, smart transportation system can actually leverage on real-time data to ensure that people find the best routes to get to healthcare services or to access these services, to make these services more accessible. But we can also think about how can actually leverage on AI system to improve air quality, therefore fostering better health, healthier and livable urban areas. But for us to then leverage this technology, we have to ensure that they are inclusive and it should be inclusive and cultural sensitive. And we believe that Ubuntu ethics can really ground AI systems for urban health to be developed and deployed and used in a way that is fair, but also equitable for all community members. Thank you.
Thank you very much, Lameck, for this great also presentation. I think this has been a really interesting approach to seeing AI from a local perspective. In fact, one of the foundations for a good governance, according to UN Habitat, is that governance derives from the real experience from cities. And I think you expand that in the Ubuntu ethics also as from the experience of different communities. I'm also glad to see that you pointed that it's really important that we look at technology from this impact and in what it can improve for the lives of people. So it's really aligned with the people-centered approach as well. I think it's very interesting what you said, that there's a need to also localize and contextualize data sets as well. We know that a lot of this AI, as we refer to broadly, AI systems, applications, they are making these decisions and automations, and they work based on the data set that they are trained on. So I think contextualizing the data set, looking at it from a local perspective is really important. And I think what you said also, that looking at it from the community perspective and also seeing the connections with other infrastructures is a very also interesting approach, like smart transportation that can make access more equitable and make it a service should be delivered to people and all. So I think that's really interesting from also UN Habitat perspective, who is the one who holds the SDG 11 as well for cities and all their SDG 11 targets, for example. So I'm looking here for questions now for our speakers. We have Sarah, Catarina, and Lameck with us. Let me have a look at the chat. Okay, there is a question here in the chat from Zyrene. The idea of smart cities can only be further expanded if the community members are also connected to the latest technologies. From a policymaker lens, how can we bridge this gap between technology and actual communities? As many people are not aware of the concept of the AI, even though they are based in urban areas. So would you like to answer these questions, any of the speakers? From a policy maker lens, how can we bridge this gap between people and between people, communities, and technology?
I'm
Sarah?
happy to start us. Yeah, I'm happy to start us off. It's such a good question, and you really can do a lot with sensors, satellite imagery, and computational automation to kind of like close data gaps around so many different environmental and social variables, but you still really need capacity and resources in civil society to make these insights more than an academic exercise. And that really relies on, all the examples that I presented could have no impact in the world if there were not folks on the ground that speak all of the relevant languages, that are working in like deep partnership and are considering kind of like, where does you have an analysis, you have a set of scenarios, and then what happens? Is there funding? Is there local ownership and understanding of what the technology or the tool is? And so, yeah, bridging that kind of innovation and also like autonomy around folks around their own data is also really important.
Thank you very much, Sarah.
And maybe if I can add little, because I worked a lot on open data as well for a long time. And one of the things that we really did was coming up with hackathons. And one of the things that we had with this hackathon was to have communities co-creating solutions. And as part of co-creation, they actually define how they want to access it. And one thing that we always found in Africa was that we do not always have to create these solutions at these high-end solutions, but you can also create something which people in Europe don't know anymore, a solution called USSD, which even with a low feature 2G phone, you can access a certain service, but behind it, there's actually this service is driven by AI, but you only have small options that you can choose from. So these are really some ways to some approaches to make sure that the services are not only limited to people who can afford certain phones, but even those that can afford smartphones can also have access to these services, but in a different way.
Thank Lameck. No, great addition as well to complement Sarah's. I see one hands up also. Fernando, over to you.
Thank you. First of all, compliments for this great meeting. The topic's really relevant, and so it brings a lot of questions. But first of all, I'd like to ask, how can we challenge that gap efficiently? When we discuss urban health currently, but at the same time we have those gig economies running on the cities, on the services like Uber, etc., and the mental health by its side. So how can we address that? Knowing that these are increasing issues for us in the cities, and that involves jobs, work, and etc., all the chain. And I just like to bring also the idea that Ubuntu is it has also been used as the name assistant in computing, but at the same time, it seems that we are working by the other side. By Ubuntu has everything to do with machine learning, with neural networks that they work with the notion of the completeness, but at the end, we have still a lot of increasing inequality in the world. So there's a system that runs those algorithms, etc., that does not help us to deliver more equality to the world. So it's basically how do we deal with the capitalist approach of that are behind data, and how all the systems and all the jobs and how the way we relate ourselves to the urban health in general. Thank you.
Thank you, Fernando. Is this a question for Lameck, perhaps, or the others also would like to jump in?
Maybe for all of them. It started while Sarah was talking, but when Catarina came, and then when Lameck wrote, so feel free. Thank you.
Okay, good. Maybe 2 minutes then from each of you, of the speakers, if you want to just comment on the questions. Catarina, do you want to start?
Yeah, I can take the one on the capitalist approach, because I think this is sort of solved by Society 5.0 vision. I think I brought it up just a little bit, but with this idea of hyper-personalization of everything, and also connecting all systems that exist within the city and within, as much global as it can be, as holistic as it can be. What you have is that you might not need to have this monetary economy into play anymore. And rather, instead of focusing on this idea of economic growth, they are favoring the human value, so the flourishing of human nature, and how the resources can be managed by a more global system that can then redistribute it in a more efficient and optimized way, and also be responding to each individual at the right time with the right resources, because we will have this knowledge in a way centralized and decentralized simultaneously. So I guess if this can be into play, then the problems you are expressing about this sort of multi-layered complexities in urban systems could also be framed or mitigated within this kind of approach. And I would also, if I have time, I would love to respond to this person on privacy, because it's a very pressing topic.
Yes, definitely. We can open for you if Sarah and Lameck has anything to add as well.
On Fernando's question, yeah, I could jump in. Your question is so timely, and it reminds me of Meredith Whittaker, the president of the Signal Foundation, had this great line: if you project everything far enough into the future, you leave the status quo untouched. And we can get really abstract and hopeful and idealistic about how somehow we're going to switch from this capital-driven society to a society that is driven by the values of, human and planetary well-being, but layering technology onto that to make things less accountable, less legible. I'm deeply suspicious that that's the path we get towards a stronger focus on human rights. And, we don't have a ton of time to go totally into regulation and everything, but, a lot of the the examples that I gave around automated tools that can harm equity in an urban context are really about risks to human rights. And I think that planners and health professionals can add their voices to governmental and non-governmental efforts to protect human rights in the urban realm and beyond through really robust regulation, and to focus on that rather than on the hypotheticals of the different very specific scenarios and kind of like long range issues that are being proposed.
Thank you, Sarah, for that as well. I'm mindful of the time, but I think we can open for Lameck if you want to complement anything as well.
No, I don't. Because of the time, I won't say much, because me trying to distinguish Ubuntu from the Ubuntu from computing is gonna take a little bit time. But read that paper that I'm gonna share on the chat, which is our new paper on Ubuntu ethics, that was published at FACT. And then maybe if you wanna engage, we can engage more.
Great, that sounds good. Also, there's a lot of questions in the chat, so I also encourage everyone to connect with the speakers, follow more about their work as well, and the work that UN Habitat's doing in urban health. So, Catarina, you have 2 minutes maybe to add on the privacy, and then I will close and we'll give you some last information also for everyone.
Thanks. I mean, this is also a long discussion, but I will try to summarize it. So I've also been talking with a lot of people about the meanings of privacy and how it became connected with the idea of personal data, and how this is probably a very EU-centric discussion, and how it does not make any sense in other geographies and other contexts, or it has to be approached from a different perspective. And I guess, to me, we have to consider also this erosion of the value of privacy as a shift of paradigm, because maybe what matters, it's not privacy per se, but the idea that we are exploiting humans as data subjects in a way. So this is sort of where I'm positioning myself at the moment in terms of the privacy discussion, but more to come.
Thank you, Catarina. Indeed, I think just to close then, fortunately, we are already on time, but just to close, I think this is something we have seen throughout the presentations, is the potential for different applications in cities in terms of infrastructure, delivery of service, individual rights, and then the challenges and risks that they're also embed on that. And I think to have a really a human rights-based approach to AI and make sure this is people-centered, you need to really understand the very local context, how the data of the local context that feeds the systems are used, if they respect or not privacy, if there is a real value for using that information, and what is the purpose of the application automating, what is automating for whom, for example, who benefits from that. And I think that also this last portion of the discussions in the last few minutes about the individual and the person and how we can understand how they perceive privacy, what is their priorities in terms of data, if they would be willing to share the data or not to receive better services, to receive this positive impact that AI could develop, for example. So I think I'll leave with those final considerations of this session, and then I will like to thank all the speakers for being here with us today with these very insightful presentations. I'd like to thank all the participants who have been super engaged. I wish we have more time, but perhaps we can organize another one in the future to go a little bit further on these considerations. And then I'd like to thank also Karen and Christelle for organizing the session. Thank you. Over to you, Karen.
Karen, you're muted.
Thank you so much, Livia. Thank you so much. Before we say goodbye, we just want to run a knowledge poll again to see if through this session we managed to increase your knowledge on the topic. So again, we'll see a prompt that is going to come on your screen, and you can try to rate it, the session, and how much you learned from it. You will see from a scale from 1 to 5 how much you learned. From 1 being minimal, 5 being really highly informative. Yes. Okay. That's really good. We went from really 40%, people are still answering, to 57% to 60%, which is really good. So thank you so much, Livia, for moderating our session today. And thank you so much for our speakers for their valuable and insight interventions that they shared with us today. We would like to announce our next event that will happen. Yes. This is our next session that will happen, a learning session 2 that will mostly concentrate on exploring migration, but also urban health challenges. Yes, we'd like to have you all in again and have a great time. Thank you for today and thank you for joining. This is the end of our session. And if you'd like to receive updates or news from us, please feel free to fill the form that we'll post in the chat. Thank you so much.